Thank you for staying glued to QTV. Time now for the news. Zambia has for a fourth consecutive day not recorded new cases of coronavirus, while 2 more people have been discharged. The Zambia Police Service has recorded an increase in the number of cyber-related financial crimes as people switch to electronic transactions in the wake of COVID-19. And the Zambia Institute of Architects says it has designed an ideal coronavirus emergency isolation facility which can be set up in 2 weeks. Here now is the news in detail. Zambia has for a fourth consecutive day not recorded any new cases of the coronavirus, while 2 more patients have been discharged, Health Minister Chilufya has said. Speaking during a daily coronavirus briefing update, Dr. Chilufya says this is from 99 tests conducted involving 72 truck drivers who came in through the country's points of entry and the contacts of the deceased patient. He says the 2 discharges have seroconverted and have tested negative twice, bringing the total number of discharges to 5. Dr. Chilufya says that the 3 patients that remain in isolation facilities in Masaiti and Lusaka are stable. The minister was, however, quick to state that while the cumulative number remains at 39, with 1 death and 5 discharges, it is not time to relax as COVID-19 remains a great threat to public health. He has encouraged people to stick to the guidelines, stating that the war against COVID-19 is ferocious, therefore people need to stay at home.
In the last 24 hours, our team carried out 99 tests, and these tests involved 72 truck drivers who came in through the ports of entry in the country. It also involved the contacts of the deceased patient. May his soul rest in peace. And out of these 99 tests that were carried out in the last 24 hours, we recorded 0 positive cases. Therefore, Zambia has recorded 0 positive cases, and this is a 4th consecutive day of 0 reporting. We therefore remain with a cumulative number of 39 cases, with 1 death. Furthermore, we have discharged 2 more patients who have seroconverted and have tested negative twice. Therefore, we have recorded 2 more discharges, bringing the total number of discharges to 5. To sum it up, cumulative number 39, 1 death, 5 discharges. The 33 that remain under our care are stable and are being looked after in our isolation facilities in Masaiti and in Lusaka. In the last 24 hours, our team carried out.
And Dr. Chilufya has assured people living around the University of Zambia, which has been designated as an isolation facility for the mandatory 14-day quarantine for people coming into the country, that they are safe. He says police officers have been deployed around the facility to ensure that those that have been quarantined do not stray off the facility.
Invoking the provisions in the Public Health Act, Cap 295, Statutory Instrument 22, UNZA, the new residence has been transformed into an isolation facility to ensure that those who come in do not pose a risk for the population. They are quarantined so that if they have the disease, they do not start human-to-human transmission in the community. It is the reason we quarantine them in such safe spaces. They are under guard and they are not at liberty to move and engage and go into the community. Some of these have homes right here in Lusaka and they are quarantined there. After having tested them and they have tested negative, now our teams will engage in a system with a sensitive tracking system where they will be discharged an appropriate day but still followed up. As you know, the incubation period is 2 to 14 days, and also conversion usually happens around 4th to 5th day. So there are measures that are being put in place now that those who are tested negative would be allowed to go home, still under some tracking system. The people of Kalingalinga, the people of Unza are safe. As we designate institutions as areas of quarantine, We take into consideration a lot of technical matters and will never act irresponsibly to put any community at.
The Zambia Police Service has recorded an increase in cyber-related financial crimes as people switch to electronic transactions in the wake of the coronavirus outbreak. Police spokesperson Esther Katongo says fraudsters have taken advantage of the increased online financial transaction services and are swindling unsuspecting members of the public. Mrs. Katongo says in the past 3 weeks, the police service has recorded 56 reports in which people have been swindled out of various amounts of money, the highest being 21,000 kwacha. She says in some instances, fraudsters are calling unsuspecting members of the public, pretending to be officials from some banks, asking for bank details such as taxpayers' identification numbers, TPINs, and national registration card numbers, NRCs. Mrs. Katongo adds that in other cases, fraudsters are calling people and are pretending to be officials for mobile service providers, purporting to be conducting network tests and ending up getting information which they are using to get account details. She adds that the reported fraud cases, Lusaka Province recorded 21, Copperbelt 18, Eastern 4, Central Province 6, Southern, Western and Northern provinces recorded 2 cases each, while Northwestern recorded 1. Mrs. Katongo has since advised members of the public to always verify any information requests or promotions with financial or business institutions before committing themselves to any online transaction or before giving out personal details.
In the past 3 weeks, the Zambia Police Service has recorded 56 reports in which people have been swindled out of various amounts of money, the highest being 21,000 kwacha. In some of the reports that we have received as Zambia Police, some fraudsters are calling unsuspecting members of the public, pretending to be officials from some banks, asking for bank details such as taxpayers' identification numbers and national registration card numbers. Others are pretending to be officials from banks and are calling members of the public or people, deceiving them that their respective banks are running promotions where they are requested to deposit certain amounts of money in mobile money accounts being provided to them, claiming that it will attract an interest at various percentages, when in fact not.
The Zambia Institute of Architects, ZIA, says it has designed an ideal coronavirus emergency isolation facility which can be set up in 2 weeks. ZIA President Sidney Ngoma says the institute has formulated a task force that has been working on a design of an ideal emergency isolation facility which will be presented to the ministry this week. Mr. Ngoma says the hospital is a greenfield mini hospital that can be set up anywhere with all the equipment required electrofitted. Mr. Ngoma is hopeful that the design for the mini hospital can be approved soon by the Ministry of Health so that it can be set up as soon as possible to help in the fight against COVID-19.
So we as professionals, we have partnered with the Ministry of Health to actually be in the forefront to ensure that, first of all, the facilities that are being used for purposes like quarantining patients in this way and the isolation wards are actually designed according to the specifications that are internationally accepted by World Health Organization. So we have formulated a task force that is working on a design of an ideal emergency isolation facility, which will be presenting to the ministry within next week. And this is a greenfield hospital or isolation hospital that can be used and set up anywhere with all the facilities required electrofitted, so that you don't have to actually challenge the existing infrastructure. The challenge with the existing infrastructure is sometimes it cannot be electrofitted what you want to be. It can be achieved in this period because we don't know how far the pandemic is going to affect us. So the hospital is being designed with components that can easily be developed or put up within a few days. At least we don't want to worsen the situation. Within a maximum of 2 weeks, we should be able to put up such an infrastructure using components that can be built up together, and then we can be able to alleviate the challenge.
Chaisa Ward 20 Councillor Ruth Piri has called on the Ministry of Health to treat Chaisa as a COVID-19 hotspot and ensure that the area receives the necessary attention to avert the spread of the coronavirus. Mrs. Piri says it is now in public domain that the area is a resident to a lot of domestic workers for foreigners, especially those from India and Pakistan, who are believed to be among those that traveled to the high-risk countries between January and March 2020. She says this has instilled fear in the residents, and Mrs. Piri has noted the need to allay the fears that have gripped the residents.
As you are aware, Chaisa has been marked as a hot spot for the COVID-19 pandemic. The problem we are having in the wards, in my ward, we've got a lot of maids working for the Indians, and I'm trying to help the people of Chaisa, and not so that this pandemic doesn't spread. So right now I'm working with personnel from Ministry of Health under Chaisa Ward, the EHT. Last night we had a meeting with about 12-15 maids to find a way of helping them to get tested so that we stop the spread. The mood is not okay. People are scared. People are worried. They want government to treat Chaisa as an emergency. It's a very small ward, but heavily populated. Yes.
The Human Rights Commission has noted with concern that social distancing largely remains a challenge, particularly in public service institutions, public places and public service vehicles such as buses. Commission spokesperson Mwelwa Muleya has since called for continued compliance with the guidelines on preventing the spread of coronavirus because they are necessary for the achievement of a legitimate public purpose of promoting and protecting the rights to health and life. Mr. Muleya has noted that some essential workers have not been provided with adequate personal protective equipment, a situation that is compromising their rights to health and life. In a statement, Mr. Muleya says failure to adhere to the guidelines and providing personal protective equipment to those on the front line of fighting the coronavirus could reverse the progressive achievements being made towards containing the spread of the COVID-19, and this can have far-reaching consequences on the country at large. Mr. Muleya says it is necessary that all stakeholders, including employers, continue to abide by the public health guidelines during this difficult period of fighting the coronavirus pandemic in order to save lives.
What must be appreciated is that these guidelines are meant to safeguard the public good, the benefit to society at large, and we must, for the time being, endeavor or strive to comply with these guidelines because the benefits far outweigh the negatives. Therefore, we must also ensure that those who are vulnerable, more vulnerable than others in society, such as the persons with disabilities, the elderly, the child and female-headed households, and those with underlying health conditions are supported in order to cushion the impact of these measures. And this we expect all stakeholders to really come together and have a holistic approach to the fight against the pandemic in terms of applying health conditions, but also taking into account the social and economic sphere in life so that there's that balance to also support individuals to better adhere to these guidelines.
Medical for Quality Healthcare in Zambia Director General Dr. Quince Mwabu has encouraged medical practitioners attending to COVID-19 patients to follow guidelines as they are attending to patients. In an interview with QTV News, Dr. Mwabu says the COVID-19 pandemic is putting health systems around the world under immense pressure. He is saddened to learn that some health workers are now contracting the virus in their efforts to treat patients.
We are also appealing to our dear medical providers, those who are attending to our patient, our beloved patient who are affected with the COVID. As you are attending to our dear patients, let's also be alert. Let's also be cautious so that we also follow the guidelines so that we can also prevent and avoid being infected with this coronavirus. Because as a medical provider, if we've been affected, then it will be very difficult to the patients. So let's apply cautious and let's be alert, and also let's also follow the guidelines as we are attending to our patients who is having COVID.
All People's Congress Party President Nelson Musoni has prodded government to ensure that all donations and contributions towards the fight against coronavirus are utilized in a prudent and transparent manner. Mr. Musoni has stated that transparency and accountability are critical and important elements in the country's fight against the COVID-19. He has, however, applauded companies that have come forward to make donations and contributions towards the fight against the global pandemic. Mr. Musoni has stressed the need for the donations to be used for the intended purpose. He says the donations should not fall into the hands of those who have questionable credibility when it comes to the utilization of public resources.
First, we applaud Zambians and indeed companies that have come forward to make donations to government. But however, we are deeply concerned in the manner these donations are being conducted, are being received. We think that accountability is an important element in the management of these funds. These undoubtedly are public funds. Once these funds are given to government officials or are donated to government, they are public funds. And some of our colleagues whose credibility in public service has been questioned should be the last people to be receiving these funds. We are deeply, deeply concerned that the ultimate end will be that COVID-19 funds have vanished in thin air. I think our citizens are sick and tired of embezzlement of public funds.
The African Union Bureau of Heads of States, comprising leaders from South Africa, Egypt, DRC, Kenya and Mali, have called on creditor nations and multilateral institutions to immediately suspend interest payments for Africa on its external public and private debt. This is to enable African countries create a physical space to respond to the devastating effects of the African economies by the COVID-19 pandemic. Zambia's ambassador to Ethiopia and permanent representative to the African Union, Emmanuel Mwamba, says the communique of the leaders of the African Union Bureau was issued after they held the latest teleconferencing meeting on 3rd April 2020 to discuss Africa's response to the COVID-19 pandemic. In their communique, the leaders have called for a comprehensive stimulus package for Africa and for concrete support as pledged by the G20 and other international partners. They have also called upon the World Bank and International Monetary Fund, IMF, to review their current disbursement policies to display flexibility and speed, including raising the availability of the IMF Special Drawing Rights, SDR. Some of the leaders who were part of the teleconferencing meeting include President Cyril Ramaphosa, who is chairperson of the African Union, President Abdel Fattah al-Sisi of Egypt, President Ibrahim Keita of Mali, President Uhuru Kenyatta of Kenya, President Felix Tshisekedi of the DRC, among others.
In light of the COVID pandemic that is ravaging across Africa, the Bureau of Heads of States and Government met on Friday, 3rd April 2020. They've proposed some far-reaching measures that should be implemented immediately. One of the key ones is that the pledges that have been made by the G20 that met 2 weeks ago should be fulfilled. They've called for cancellation of debt, deferment of debt, and suspension of interest payment. The call has been made to multilateral institutions such as the IMF and World Bank. Further, another measure is that they've created coordinating committees that should meet weekly, although they'll be meeting virtually. These will be headed by ministers. So there are various committees that have been established. One of them is for health. The second one is for transport and logistics, and the other one is for our ministers of finance to coordinate effective measures across Africa.
A health consultant from the Scientific, Medical and Engineering Research Organization, SMERO, has stressed the need for members of the public to observe healthy diets as a way of ensuring their immune systems remain boosted, especially in the wake of the coronavirus pandemic. Abel Munyasu has told QTV News that health experts have disclosed that the coronavirus pandemic can prove to be deadly to those with low immunity or compromised immune systems. Hence, the need for members of the public to ensure that they keep their immune systems active and boosted. Mr. Munyasu states that the public should take time to know which natural foods can help activate their immune systems as well as keep them boosted. He has stressed the need for people to eat healthy and balanced foods which have high nutrients. Mr. Munyasu has named some of the foods that can help boost the immune system as fruits such as nuts, lemons and oranges, as well as vegetables, among other foods.
All we need is to maintain that actual strong immunity, which will be helpful in times of infection. You know, every problem that we have, we need our immune system. Whether we have a headache, whether we have a fungal infection, whether we have a bacterial infection, whether we have a viral infection, you know, we need our immunity. Let's raise it high, higher than actually we have ever done, so that it can be an added advantage against these things that are going on, these masks and the not shaking one's hands, the washing of our hands. Above all that, let's raise our immunity by every means. And those that need help, you can still come through, will be actually be able to be helpful, so that you are sure that your immunity, it is just that high. Especially my good sisters and brothers, those that are in the front line, you know, those that are in contact, those are helping those that actually have tested positive. Get your immunity to that level so that you do not have a chance of ever getting this problem. Let's go for citrus fruits and get vitamin C. Let's go for lemons, let's go for oranges, let's go for nuts, let's go for these green vegetables that we can eat actually without even having them exposed to heat. By so doing, we'll be doing ourselves a favor. Those foods that we can blend so that we can take them raw, the body actually will get a positive benefit.
The opposition UPND has described as alarming revelations by Lusaka Mayor Mao Sampa that the city market management only remitted 60,000 kwacha to the council of the 13.6 million kwacha collected in levies and fees. UPND Deputy Chairperson Local Government and Housing Brian Ndumba says this could be the reason the PF government has deliberately delayed the appointment of market boards to allow the cadres to run the markets and bus stations. Mr. Ndumba says the Markets and Bus Stations Act of 2007 is very clear on the management of markets and bus stations in Zambia. He says the failure by the Minister of Local Government to appoint market boards can never be viewed as an administrative oversight on the part of the minister, but a deliberate ploy to plan the public resources. Mr. Ndumba has since challenged President Edgar Lungu to ensure that public resources are accounted for. He says President Lungu is expected to promote a culture of consequence where touching public resources for selfish reasons would not be condoned. He states that Zambians expect their resources to be properly accounted for and utilized for their betterment, not to be looted. Mupamanzi Primary School headmaster in Mpika District, Ham Sinyinza, has noted the need for improved access to information for school-going children and members of the community on COVID-19. Mr. Sinyinza has expressed concern that people in the communities have little or no information on the virus. Meanwhile, Mr. Sinyinza has appealed to the Ministry of General Education to improve internet facilities in rural areas. He says this would enable pupils to continue learning online during this period of COVID-19. Here is a report.
Mpika District, which was the largest district before the division in 2017, has an estimated population of 150,000 inhabitants. The population density was less than 4 people per square kilometer. With the fight to curb COVID-19, Mpika Mupamadzi Primary School headmaster Hamsinyeza has noted the need for people in the area to have access to information on the virus.
Kuna idea shiri ya coronavirus. iri lyashi kumulandu n'okubulwa kwa access information nga mumalulu areas abantu balingire bakwata ukwishiba bwino bantu kunchende nga kuno bachilifya babula okwishiba palwawo bulwele bwa coronavirus echilera nga kwabati nga bwalishile kuti chaposa enshita kubuchimfya nomba chilefweka ubuteko bwafwako nshira limbi yakuti abantu bahishiba bwino bantu abali mu towns na munchende shasensoboka bena at least baliko aware palwa ubulwele.
And other residents share what they know about the virus.
Kulaendauka era takuli ukuikala okuli chintu bwingi
buli bwa coronavirus bukwaikwa lyonse omuntu mukoshana bamwe bakwete bulwele muri pushana mwasamba kuminwe
nesopa ishteli yonse ulingiro kula chingiro kusamba kuminwe kula pushanya muminwe nishibole ichingirira.
Meanwhile, Mr. Sinyiza says there is need to improve internet facilities in different schools.
Chino palulolu bali ilo ubulwele buchili bule apantanshi ubuteko bufulibwa pela ku roadmap pakumono kubatushe chala abashani natushi bali mbi kuntanshi nga chakuti bwaputuka bwangu limbi kuti kwaba ukwisula bwangu amasuku kuchitakava inshita ya poswa kopamuma yakumona fyo bulwele bwala chipiwako kwena icho ubuteko bufulibwa chitaingenyi natushiba kuli kuno enshira shimbi isho nga bali amasuku yambi yali esambi kubonfya mera basa lero kuli aba bambi abana bamalulo areas bapala ba grade 7 ba grade 9 bena tabakweteko facilities ya kutibinga kwato kusambira kutsapa online.
Indeed, there is need for everyone to get involved and sensitize members of the public, especially those in rural areas, on COVID-19 preventive measures. Reporting for QTV News in Mpika, I'm Gaona Kanya.
Zamtel has announced that it will offer all its customers free calling minutes and data during the period the country is faced with the COVID-19 pandemic. Company Chief Executive Officer Sidney Mupeta says all Zamtel mobile prepaid customers will receive 5 free minutes on-net calling, 50 MBs of data and a further 10 on-net SMSs as part of the company's corporate social responsibility during this period. Mr. Mupeta says the offer will allow customers to remain connected with family and friends during this difficult period. He explains that customers will be able to enjoy this offer on Tuesdays, Thursdays and Sundays starting this week. Mr. Mupeta says and states that the offers, which will be activated by dialing *335# will be valid up to midnight on the selected days. He adds that no conditions are attached to the offer.
All Zamtel mobile prepaid customers will receive 5 minutes, 50 MB, and 10 SMSs on selected days is a corporate social responsibility. And customers will be able to enjoy these benefits on Tuesday, tomorrow, Thursday, and Sunday. And this free offer will continue until the COVID-19 is officially announced that it's over. Zamtel's key priority is keeping people connected during this period. During our strong belief that all our customers should be connected, we have announced this free calling offer as part of a contribution to this fight against COVID-19. We want to encourage people to stay home but remain connected to their families and friends. We know that the pandemic has negative effects on the lives of our customers, and our hope is that this offer can help cushion this impact. We will continue to work with stakeholders in order to fight the spread of COVID-19. Recently, we partnered with the Ministry of Health, where we are providing frontline staff with closed user group free calling amongst all group members, and provided 500 phones and contributed 200,000 kwacha towards this fight.
Zambian DNA has welcomed the African Union's recognition of Zambia as one of the few proactive countries in scaling up the preparedness response for COVID-19 even before it recorded its first case. Zambia DNA spokesperson Spooky Mulemwa has also commended government for demonstrating a tactic commitment to fighting the COVID-19 pandemic. Mr. Mulemwa is confident that Zambia will double its efforts in the fight against the disease and greatly benefit from being an active player and taking part in strategic planning meetings.
We also commend President Edgar Chagwa Lungu and his government for demonstrating a tacit commitment to fight the deadly COVID-19 pandemic that has earned the country's seat on the African Union's recently created COVID-19 Coordinating Committee, whose mandate include, among others, mobilizing resources, equipment, and medical supplies to help Africa put up a united response to the fight against the COVID-19 pandemic. We are confident that Zambia, under the able leadership of President Edgar Chagwa Lungu, will double its efforts in the fight against the deadly disease and greatly benefit from being an active player and taking part in strategic planning meetings.
As we end the news, let's have a look at the headlines once more. Zambia has for a fourth consecutive day recorded no new cases of the coronavirus, while 2 more people have been discharged. The Zambia Police Service has recorded an increase in the number of cyber-related financial crimes as people switch to electronic transactions in the wake of COVID-19. The Zambia Institute of Architects says it has designed an ideal coronavirus emergency isolation facility which can be set up in 2 weeks. On that note, we end the news. Thank you so much for listening and watching. Continue to stay home and abide by all the regulations and rules being provided for you. Bye-bye.